just a little bit on our anatomy for our lab practical material. So go to the cardiovascular system, and we're going to look at the heart itself. Right, we're going to look at anterior vasculature, and what I want you to see is this. Right, you see right away the heart right here, and you'll notice in the heart that you have the pulmonary trunk, most anterior, then the aorta, right? And you have branches coming off the aorta right away. Do we normally have this little artery right here? No, right? This artery right here tells me that the person whose heart this belonged to has had bypass or, right, coronary, right? Yeah, this is coronary artery bypass graft he must have had, right? This is something that's an anomaly. Most of us should not have this one artery right here. The only reason why we have this artery is that there was a problem in one of these other vessels, and now they connected it to the aorta, right, and replaced that damaged vessel by grafting a new vessel onto the aorta to resume blood supply. Normally, we only see this right coronary artery and then LAD, left anterior descending, right? The left coronary artery runs underneath the pulmonary trunk. We should never see it, in other words. This is not your left coronary artery. This should not be there. It's kind of cool, right? Right coronary artery coming down, right marginal branch. This is our small cardiac vein, the start of it. The small cardiac vein follows the right coronary artery. And again, right, the apex is down here, the base is up here. On this, it's really hard to tell which side is which, right? So the one way we can tell is only on the left side do you have this very diagonal facing artery coming down. This is our LAD, left anterior descending artery. And wherever you see LAD, you see the vein that drains the capillaries found in LAD. This is our great cardiac vein coming up and around. What else? As we remove the vein, you can actually see marginal, and then you can see the branches of LAD right here. Look how big LAD is. Remember, look how big your right coronary artery is. Keep in mind, if you have an infarct that affects big branch of LAD or a big branch of your right coronary, those are the widowmakers, right? Those are ones that kill people in their sleep. Usually the ones that we survive are the ones that are from these smaller tributaries right here. Right, now they removed it. I'm going to look at the posterior view. And then on a posterior view, again, this is the left side. This is our left, right here. This is LAD coming down. This is the front. This is the back. I don't like this view. I wish I can turn it 360. So then I can kind of turn it a little bit more. That's why I prefer the models we have. So make sure, right, you look at both the videos on the models that I have up, right? Because I will predominantly have models that are tagged for the lab practicals. I will have some pictures like this, but you can't really see the, any of the veins way back here. You can't see any of the arteries way back here. So it's not a really clear picture. What we do see really good is pulmonary veins. This is the left atrium area. These are the pulmonary veins coming from the other side. You see left anterior descending artery, LAD, and left circumflex artery. Notice the arteries are not bluish. They're big. They're almost, right, beige, white in color here. This is branches of your great cardiac vein. Over here, right, you see the left marginal branch right here. And then back here, this is our, right, posterior descending artery. Now, I don't like this as posterior descending artery just because, right, you can't really tell, right? Because of the view, whoops, because of the view, I mean, I don't know why they took a view that's this bad. I wish I can kind of make it, you know, kind of have the apex over here, make it more up and down, so then I can actually see the back. But I can't manipulate the actual picture, which is stupid, right? But that is what one of the drawbacks about the cadaver pictures we have, is that I can't manipulate it. I can't take a certain picture of it. And because of that, I can't see, right, with any great detail whether this is PDA or not. It's supposed to be PDA, right? But it really isn't a great picture. What I would use for this, if I do use this picture, is circumflex, left marginal branch, great cardiac vein, and then this big one right here. That's your coronary sinus, right? And this is PDA right here. This is your, right, posterior descending artery. Now, let's take a look at the heart and the thorax right here. Now, when we're looking at this, and I wish we had more, you know, time for the lab, right? When we're looking at this, for arteries, I want us to look and start from the heart and then memorize it as it goes outwards. Meaning, for arteries, we start at the closest area of the heart, which is your pulmonary trunk. Pulmonary trunk then separates into right and left pulmonary arteries. These are the only arteries of your body that are blue. Now, I know one of the first days we lectured, we had mentioned that in utero, what happens? In utero, are we breathing anything in utero? Of course not, right? There's no oxygen. You're inside mom's uterus. So the lungs never have to inflate in utero. So if they never inflate, how much oxygen is in the lungs? Zero. There's no oxygen in the lungs at all in utero. So what happens when there's low oxygen in the lungs? The opposite of what happens when there's a lot of oxygen. When there's low oxygen, what occurs? Vasoconstriction, right? So the pulmonary arteries become severely constricted. So constricted that blood can't move into them. So what happens to the blood that goes into the pulmonary artery then? In utero, there is a connection between the pulmonary trunk and the aorta. That connection is called the ductus arteriosus, right? In utero, this scar matter right here is an actual connection between the pulmonary artery and the aorta, all right? With our first breaths, we fill up the lungs with air. As we fill up the lungs with air, we increase oxygen in the lungs. And we saw before, the more oxygen we have in the lungs, the more dilated these pulmonary arteries become. The larger they become, the easier for blood to move through. So now blood moves through these big old arteries. Would blood want to go through this small, tiny connection? No, right? So what happens? We resume normal flow of blood flow to the lungs just with our first few breaths, right? This connection becomes scar tissue that we call the ligamentous arteriosus. Another word on our word list. That's it right here. I have models that show it a lot better, but this is a good picture of it right here as well. This is the aorta. Look how big that is, right? Now, the aorta is going to give rise to blood flow to all of our circulation. The weird thing is the right side of our body and the left side are just a little different. What do I mean? All right, notice there's three main branches coming off the aorta. There is the first one, brachiocephalic trunk. The first brachiocephalic trunk right here, right, actually provides blood for your entire right upper body, right? A trunk is a large blood vessel that splits into smaller ones, right? Now, the second main branch of the aorta goes straight up, is your left common carotid artery. So brachiocephalic trunk, first branch, left common carotid, second branch. The third branch is our left subclavian. So notice, right side only has one main trunk, one artery. The left side has two, right? Here's what happens. The left side has a left common carotid and a left subclavian. Both come straight from the aorta. The right side, we also see a right common carotid. We will also see a right subclavian, but they're a branch of this brachiocephalic trunk. In other words, right here, right? When we remove these veins, what we'll notice is that on the right side, we have common carotid on the right. The common carotid is going to bring blood flow to the brain, to the face, to the skull. So we have two sides, so we need a right and a left common carotid. We will see a right and a left common carotid. The difference is, on the left side, that left common carotid is straight from the aorta. That's from the left side. On the right side, the common carotid on the right side is coming off the brachiocephalic trunk, right? On the left side, subclavian comes straight off the aorta. On the right side of the body, well, we have right arm too, don't we? We have a right arm, we have left arm. If we have a right arm, we need a right subclavian artery on the right side. We do have a right subclavian artery, but they're not coming straight from the aorta. The right subclavian is coming from this brachiocephalic trunk. So all of the circulation for your right upper body is supplied by the brachiocephalic trunk. It comes up, it divides into the right common carotid and into the right subclavian. Whereas on the left, the left common carotid, left subclavian, directly from the aorta, right? Notice there's no brachiocephalic trunk on the left side, in other words. It's only on the right. Now what else, right? As we go through it, right here, we'll go through the shoulder region. And we'll follow through some of these arteries, right? By the way, what muscle is this? Should be easier one, right? Pec major, and then this is your deltoids, sternocleidomastoids over here. And we're going to see an external jugular vein right there. That's a pretty good look. Internal jugular vein. This is your, right, your clavicle, pectoralis minor muscle. Now, you know, I mean, this actually is a lateral thoracic. I don't think I have this on our word list, so you can just ignore that. So right here, we're going to see, right, your subclavian artery. The subclavian artery is going to be kind of intermeshed with the brachial plexus. Now, we do see, right, a little bit deeper yet, when we'll go through it in a second, the carotid in a second, right? So let's take a look as we can remove this, right? The subclavian, as it goes past, right, as it goes past your latissimus dorsi over here, right, it turns into your brachial artery. So subclavian, and usually what we have is, you know, in the model, we can use the head of the humerus as the main location source. When the brachial or when the subclavian artery passes, and you can imagine, here's the head of the humerus, there's an imaginary line here. When that subclavian artery passes that, right, imaginary line, it becomes a brachial. Now, in between, in the armpit area, this is your axillary artery. Oh, that goes a little too deep. All right, now let's take a look at the veins. It's still the same. All right, let's look at the head and neck region. Right, now, arteries are going to be slightly different than veins just because arteries, some of them are more superficial, right? So here's your sternocleidomastoid muscle, This is your external jugular, right? This, right? So when you take a look at this, right? Again, I want you guys to be able to find these, right? And they have little ways to kind of quiz you on them as well. So one of the ones that we have is a facial artery. The facial artery is a branch of your external carotid artery. And with the facial artery right here, right, it comes up, it goes up at an oblique angle, diagonally, past your mandible, right here. And it is a branch of your external carotid. And your external carotid artery, right, should be right underneath the internal jugular. Let me see if I can remove that. Right there. So here's a common carotid artery. Your common carotid artery is going to turn into your external carotid and your internal carotid. External carotid stays superficial. So it's going to give rise to arteries that goes to our face. It's going to give rise to arteries that goes up here and turns into our temporal artery. Now, this superficial temporal artery right here, what I want you to do right here is this. I'll show you a video of this. I want you to feel right on the side right here. When you feel right on that side, right, you'll feel an artery that courses through next to your temples. That is your superficial temporal artery right there. And sometimes you might have pain in that area. And that is what we call a temporal neuritis, right? That does happen in some people. But you should be able to palpate this kind of vessel, just you know, it's superficial, but it's just slightly deep to your skin, right? That is what we're actually palpating. That is our superficial temporal artery. Now, the superficial temporal artery is the terminal branch of our external carotid, meaning it is a terminal endpoint, right? What else do we see with the external carotid? We're going to see that it gives rise to our superior thyroid artery, right? It comes down and goes to your thyroid gland. It gives rise to the facial artery that courses up right here. This is our facial artery, right? Now, here you can also see the tags, so you can quiz yourselves when you guys have a chance, right? So you can see external carotid, internal carotid over here. There are some of these I don't have on your word list. If it's not on your word list, don't worry about it, right? I'll only ask questions on the word list, right? Angular, so all of these. So if you hear, you know, alveolar artery, that's not on our word list. Don't even look at it. But if you have one that's like the superior thyroid artery coming down, that is on the word list, right? I do want you to know it then. Right now, the occipital artery, I don't have on the word list, right? So let's take a look at the brain region. Let's see if anybody have any questions. Both. I would be using mostly models because it's easier for all of us to see the models, right? But I think that, you know, with the models that we have, I wish we had time to physically interact with it, but we can't. Now, there are some here that says you can do 360, but there are only certain pictures that they allow us to turn and look at. So that's why we don't use it. I think it's only the eye or something that they have that we can kind of manipulate and turn into 360. See that? We can manipulate it, but that's not a cadaver model, is it? Right? Now, the good thing here is we can see one of the arteries that I do want us to look at for the brain, right? Quick question to you guys. How can we tell a cervical vertebrae versus a thoracic vertebrae? So we have a cervical vertebrae and it's not attached. And then we compare it with a thoracic vertebrae that's not attached. How can we tell one is cervical and one is the other, besides size, because C7 and T1 are going to be very similar in size. So how do we tell the difference between that? Right? Now, bifid, some of them are bifid. Some of them are not bifid. Right? Some of these are, take a look at C7. Right? That's not a bifid spinous process. The one way we can tell one versus the other is the presence of a transverse foramen. Right? It doesn't matter where we are. Whenever we see a transverse foramen, we know it's a cervical vertebrae. Only cervical vertebrae have transverse foramen. Why? Because only cervical vertebrae has this artery that goes through that transverse foramen. That artery is called the vertebral artery. And the vertebral artery starts at your subclavian. So it's above your shoulder. So there's no need of it in your thoracic vertebrae because you don't have that artery going down. You only have it ascending from your shoulder upwards. So only the transverse foramen, right? Only the cervical vertebrae will have the presence of the transverse foramen. So when you look at a cervical vertebrae and you see it right away, right? You look for little space, little opening on the side. If you do see the transverse foramen, that's where this vertebral artery is going to be resting, right? And that is one of the words that are on our word list. Is the right vertebral artery. Now the vertebral artery come up right here. So this is the vertebral artery. So the vertebral arteries are in the back, comes up. As it comes up, it goes into the foramen magnum. It goes and it fuses together to form our basilar artery. The basilar artery kind of looks like a little, right, snail, looks like a little caterpillar. It's got little arms that come off of it. This basilar artery is very important for it's there for the medulla oblongata. It's there for the pons. It also helps supply some of the cerebellum. So all these arteries right there have real functions in that it supplies nutrients to those areas. What else do we see? Right? So you have the two vertebral arteries. They fuse to the basilar. Then the basilar moves up and it turns into what we call our posterior cerebral artery over here. The posterior cerebral artery over here is going to give rise to circulation to the parietal and occipital lobes, right? So right here is the posterior cerebral artery. Now, we have what's called the circle of Willis, right? The circle of Willis are these little connections right here. These little connections that we call anastomoses, right? And anastomoses is a connection between one artery and another artery that should not be communicating with each other normally. You should have an artery going this way, another artery going maybe lateral to it, but then in some people, they have a connection in between. That's an anastomoses. Arterial anastomoses are almost always a good thing, right? Anastomoses allow us to have alternative ways to bring blood to a certain area. What do I mean? Right? What I mean is this. What would happen if I have a blood clot right here? Right where the basilar artery splits. As a basilar artery splits right here, on top, it's going to split to the posterior communicating artery on each side. What would happen if right before it splits, I have a blood clot right there? What would happen is you're going to have very little blood flow going to this posterior cerebral artery. That means all of the blood is going to be severely restricted going into your parietal and your occipital lobe. This is a massive type of a stroke, right? So how can our body and how can anastomoses help with that? Well, without the anastomoses, we're limited to how much blood that can go through here. with the anastomoses, that's what this little artery is. This is a connection. This is an anastomosis. This is a communicating artery between our very large middle cerebral artery. This is our middle cerebral. Look how big that is. So we can have a lot of blood flow going to the middle cerebral artery. As a branch of the middle cerebral, we see this small connection called the posterior communicating artery, one on each side. Right? Now, what happens? If I have a stroke right here and I have a blood clot right there, without this communicating artery, I would have devastating results because there's no blood or very little that can get through that clot right there. But with the posterior communicating artery, blood can go from the middle cerebral, go into the posterior communicating, and you can replenish some of that blood supply, right? So instead of blood going through and all the way around like this, you can still that blood flow by having alternative means of bringing blood through, right? These anastomoses, these communicating arteries, you have 1, 2 on the backside. We call these the posterior communicating arteries, right? Those posterior communicating arteries allows us to bring alternative means of blood flow, right? So then we can mitigate a problem if there is decreased blood flow, if there's a blood clot in any one vessel. So this circle of Willis provides anastomoses and alternative ways to bring blood to the most important region of our body, which is our brain. Again, vertebral, basilar, posterior cerebral, posterior communicating artery, one on each side, allowing the posterior cerebral to communicate with the middle cerebral. Look how big that middle cerebral is. It's huge. Why? Because it goes to the temporal lobe. It goes right to your insular lobe, very important structures found in your temporal and your insular region, right? And then in the front, we see what looks like little antennas up there. This is your anterior cerebral arteries. One on the right, one on the left, right? And then you have an anterior communicating artery right here that allows you to also communicate between one side and the other. This is perfect, right? Why? Because if I have a stroke and the stroke happens right here, if the stroke and the blood clot happens right here on the right anterior cerebral, right, region, well, I'll have decreased blood flow to that right side of my brain. By having this communicating artery, I can replenish some of that, right? I can have blood redirected through this communicating artery and then reinstill some blood flow and mitigate some of the issues that I might have as a result of a blood clot way over here. If I have a blood clot way over here and I don't have the communicating artery, let's say this is gone, right? And I have a blood clot right here, all of your brain matter will be affected. That's a severe stroke. By having this communicating artery right here, even if I do have a stroke and a blood clot right there, I can mitigate, I can lessen some of the issues because I can redirect blood and reroute it through the communicating artery to the other anterior cerebral artery. So then I can at least bring some blood to that area that wasn't getting any blood to begin with. It's kind of cool, right? This forms a circle, right? Anterior cerebral, one on each side, anterior communicating, middle cerebral, posterior communicating, and then all the way down around, posterior cerebral. This I can probably use the circle of Willis for a picture, right? Cadaver pictures, actually pretty good. Again, middle cerebral, anterior cerebral artery on each side. The one that conjoins them, anterior communicating. middle cerebral, and then posterior cerebral. One that connects them, posterior communicating artery. Not too bad, right? Now, in terms of the veins, we will see, right? The important part is, number one, right, look at how tight your dura mater is to the skull. This is why when you have even an epidural bleed, meaning that you have a bleed outside of the dura mater, right, you can have some devastating injuries as a result, and even death as a result of it. Because there's just not enough room in your skull cavity for any kind of bleeds. If you have a bleed here, it will push your brain down the brainstem, herniating the brainstem, right? If you guys remember, we separate the brain, right? We have the longitudinal fissure separating the left and right hemispheres. In between the longitudinal fissure, we see this piece of dura mater separating it. This is our falx cerebri. It continues back and turns into the falx cerebelli, right? Again, we completely partition the brain from each other. Now, as we open it up, then you can see a couple of the sinuses. This is what we call the superior sagittal sinus. The superior sagittal sinus is a large vein found on the superior part of our falx cerebri. Then you see transverse sinus over here as well. The transverse sinus, right, found on your tentorium cerebelli, and the main purpose of these is to drain blood out of the skull and into your internal jugular arteries. So there's superior sagittal sinus, and then on the sides, the transverse sinuses, one on each side, even though there's only one superior sagittal sinus, right? Now, besides the actual sinuses, there aren't a lot of veins of the brain that I want you to memorize, right? So I'll use a combination of, cadaver pictures. And cadaver pictures are good, but they're not great, especially if I can't manipulate it, especially if I can't turn it, right? And because of that, I'm more prone to be using models as a, especially for the arteries and veins, right? I will get a model. I think I'm supposed to get down to downtown campus. I will have the Wireman model that I have videos to. And for arteries and veins, that will be what I'll be using. Wireman model, as well as the board model. Now, some of the, cadaver pictures that I showed you just now, like this, right? So when we looked at, right, this one right here, we can really see the brachiocephalic trunk. So that's a good picture that I could use. And I only use pictures where I think we can see it best. I'm not trying to trick anybody, right? I want to find the best view, and it's there so then you can know what it looks like regionally. The worst thing I want you to do is to go over there and just think I'm tricking you, right? If I wanted to trick, if I want this class to be really hard, I could make it really difficult by showing you different actual pictures, right? But I want it not to be as difficult as possible. It's already hard enough. So when I'm looking at these pictures, I'm looking at it and I will use the pictures in a way where, okay, like what we see here. Wow, you can really see that brachiocephalic trunk really well. So at that point, I might use this picture to show the brachiocephalic, the left common carotid, and the left subclavian. Right? At the same time, right, when we look at the veins, we'll also see the veins, right? Here's our subclavian vein. Here's our internal jugular vein. When those two veins combine, they change names. Here's our brachiocephalic vein, right? So now on this, we can see brachiocephalic vein really good. We can see the left and the right subclavian veins. We can see the internal jugular veins really good. So I might use a picture of this for all of those because you can see it so well, all right? Now you have the two brachiocephalic veins, one on the right, one on the left. When the two brachiocephalic veins fuse together, it forms a superior vena cava, right? So Arteries change names when they separate. Veins change names when they fuse. So when you have the subclavian vein, it fuses with the internal jugular. It turns into the brachiocephalic. When you have the left and the right brachiocephalic fuse together, it turns into the superior vena cava. See how that goes? All right, so I know I've been talking for almost 3 hours. On Tuesday, we will go through chapter 21. I will release the test, right? It will have chapter 21. You don't have to take it until, right? I'll probably extend it from like until Wednesday night. So from Sunday till Wednesday night, I'll give you that kind of, you know, the few days in between to get it done, all right? I do want us to talk a little bit about chapter 21, at least live in person. I know I have those videos up already. Make sure you watch those videos, right? This is going to be a fast-moving class, and even though we will discuss some of these topics live, sometimes, right, because of the timing, we might not get to it until a little bit later, making it harder to study. So the good thing is all those videos are already up. Please take a look at the lectures and the lab videos, right? Any questions, guys?
So don't we have, so the first exam is next week, and then the first lab
exam is this weekend till next week. So
okay,
if you have to take it this weekend, right, I'm releasing it. I was going to release it tomorrow, but I'll release it, right, like probably Saturday afternoon, and it'll be due Wednesday, I'll say Wednesday afternoon or Wednesday evening.
Okay, and then
and that's on chapter 19, 20, and 21.
And then our first lab practical is next week.
Will be next weekend. Next weekend.
Next weekend?
Yep.
And then, so the first lab practical, I'm looking at the
just circulatory.
It's just circulatory. It's not respiratory.
Yeah, circulatory is enough. So it's just circulatory. So just heart, arteries, veins.
Okay, perfect.
Right? Now we'll go through more of it, right, on Tuesday and Thursday, kind of like how we went through it just now, right? So we'll go through it on next week, Tuesday and Thursday. Next Tuesday, I want us to really go into chapter 21, and there'll be parts of it we skip because we're just not going to have that time available. So just keep in mind that, you know, even though we skipped it, if it's on the videos I posted, I could ask it on the tests, right? Whatever's on the PowerPoints is free game for the test. That is your study guide, right? Especially the highlighted material. Just a little hint. If it's highlighted, it will probably be on the test somehow, all right? So look for a highlighted material to really focus on.
And so just really focus on the PowerPoints and less on your videos.
No, my PowerPoint. No. My videos goes through the PowerPoints. So, right, my videos go through PowerPoint. So you're gonna need to kind of go through both, right? And then my videos, I'll tell you what to really focus on. And if I repeat myself a lot in the video, then it's probably gonna be on the test. So you need to review both.
Okay, where are the videos? Oh, it says lecture videos at the bottom.
Right in the lecture videos.
Okay.
Somebody hasn't looked at the lecture videos. It's all right. All right, so look at the lecture videos. It's under lecture videos right here. All right.
Okay.
What happened to chapter 19? Sorry. Let me see. No, those are lecture notes. All right, so here. All right, so lecture videos, I have the blood one up already. All right, and I have the cardiovascular system up. And these are a little bit, you know, more pinpoint, right? So we talk about fibrous skeleton and all that stuff, right? And I know it's kind of a weird angle, but the thing about this is that these are identical, and some of the PowerPoints, if you don't see it right here, I did not think on ours that we mentioned not pericardium, right? Well, if it's not on your PowerPoint that's up there, write it down, right? So there's a reason why I wrote not the pericardium, because people confuse the fibrous skeleton with the pericardium, and it is not the pericardium, okay? So review all of those, and I do give you hints on those lecture videos. So review them all. And again, with the cardiac cycle right here, right? I have a video just about this slide because it's so important. So if I have a video right on this slide and it's important, you're gonna see it on the test, right? You might even see it on the written part of the test, where you might have to kind of explain what happens.
Okay.
And yes, there's a written part of the test.
Okay. I'm like, that's a lot of videos, but I'm assuming that like each video is an hour long and some of them aren't even.
No,
long,
they're
so
not. Some of them,
better.
I broke it down into like 20-minute chunks, right? Yes, nobody wants to hear me talk for, can you imagine?
I'm like, that's 6 hours.
That's 6 hours. That's 6 hours. I would bore myself to death. Yeah, so yeah, these are usually a little bit more bite pieces, right? I think some of them are 15, some of them are at 20. So then you can, you know, not get too bored with me. So, right, review those when you have a chance. And then review chapter 21 this, as you kind of discuss and get ready for the lecture exam, right? I will post the extra credit stuff on your lecture assignments and quizzes. And you guys see right here, right, that I have the test ready to go, right? And I'll release it. This is, I'm gonna, you know, just kind of change the dates here, right? I'll release it Saturday evening. So people that are ready, they only have the weekend to do it. You only can take it once. And once you open it, you need to have responders to open it, right? But once you open it, you have a 70-minute span to finish it. It's about 45 questions, this part of it. 40 questions, 40 to 45 questions.
So will we talk about the lab practical next week, Tuesday?
Yep.
Okay, perfect.
Yep. Yep, yep. And here, let me show you what my lab practical would look like from my other class in the spring. Now, obviously the spring we didn't, I mean, it took me hours, right? I think the first lab practical I had to do, we didn't really have a long time to get it set up, right? Because we canceled class right away. It took me 8 hours to set up one lab practical online, which is crazy, right? So here is what the lab practical was online, right? For 201. Can you guys see it?
Yeah.
All right, so let me see if I can log in. Really? Do I need to? All right, sorry. I'm gonna, probably the easiest way to do it is to just edit the test. So what we're gonna do is have stations. And my lab practicals, right, have these number leader lines that point to it. See that?
Uh-huh.
And more importantly, it is matching. See?
Okay.
Right here. Because it was matching, it took a lot more time to make sure that there are more matches and stuff. But there's more matches than there are answers, right? So it's like this on the model. Not too bad, right?
No, not too bad. How many questions are there on
on the lab practical?
Yeah.
I think this one was 85, 80.
Yeah, because like
It's
last
huge.
semester my
It's
professor
big.
had like 100 questions. And
Yeah,
then,
usually I have 100 questions. Sometimes
Well,
110. But it's different now, right?
yeah.
On a physical one, it's easier. I think I'll probably about 85 to 90.
Okay. Well, because I'm only asking because last semester I had trouble with it loading onto my computer with 100 questions.
Nope. Mm-mm.
You had
There
no
shouldn't be a problem.
problems?
I didn't see a problem with it with this last semester.
Okay.
No. Did you guys do it through Respondus and through Blackboard?
Yeah, we did it through Blackboard, but each question had like a text box answer.
Okay.
And I think that might have been
shouldn't
part
be
of what the
it,
issue
right?
is.
But notice how I kind of do it, you know, kind of have leader lines, all right? That's what took a lot to make it kind of fair, all right? Yeah, I would say about 90 questions. Because the last thing you want to do is study for all of the words on the word list and have like 10 of them on there, right? It's kind of not fair then. Or have 50
or study
of them.
only one word list and study the wrong one.
Yeah, that, I mean, again, right? There's the word list should be kind of, you know, self-explanatory here. And what we're looking for, looking at the word list, when it loads, come on, load up. Right? And the word list we're looking for is a cardiovascular one. All right. And I wonder why this isn't loading. All right. And the cardiovascular one will hopefully, yeah, my Word programs, my Microsoft programs aren't really helpful today. You're looking at the cardiovascular system. That includes arteries, veins, and heart material. And I have, again, models with keys on here as well. The only bad thing is that it has like from the 177 class. So in some ways, right, they have everything, right? You just have to find it. They even have integument, muscular, urinary, GI, which we'll cover, heart. So they already have these models right here. Pretty good, right? And label for you guys to look at. I do have a couple of these heart models already in my office down in my, you know, in my basement, right? So it's, I'll just, you know, do something similar to this. So review that and review my videos, okay, for the lab videos.
And you said, okay, this is going to be a dumb question, but circulatory and cardiovascular, or yeah, cardiovascular are the same, right?
Really? No, they're not the same actually. All right, so it's not that dumb. It is circulatory is consists of the, right, it's the arteries and the veins. That's a circulatory, and it consists of the heart and the, you know, cardiovascular system. Right, so in, you know, it is part of the same system. So cardiovascular, usually we're just referring to the heart and the arteries close to it. Circulatory includes all the other arteries and veins.
Okay.
Right, further away, more distal. So here's that same model, right? I do go over it, right? Open it up, go over it. Every now and then you'll see me with my messed up thumb when I recorded it. So just a little warning. Yeah, they're all there, different, you know, like the circle of Willis. The model shows it well. The picture, the video that we just went through, it also shows it well. All right. So review those for the circulatory and the cardiovascular system. Okay. And we'll talk more about it as well on Tuesday after we kind of discuss chapter 20, 21. All right. Any other questions, guys? And guys, I mean ladies. I don't think I've had a single guy in the class yet. So if there are no more questions, email me. I know for most part, you guys aren't going to, you know, probably not going to start the test until next week anyways. That's why I'm giving you guys until Wednesday evening, night to get it done. So then we can at least talk a little bit about part of 21, okay? And then we can start getting ready for the lab practical, as well as start talking about immunology. Chapter 22 is, I would say it's, in terms of 202 material, in terms of just science, it's pretty dense stuff. It's pretty hard stuff. So just a little warning on that, that it is kind of a little bit more difficult, the material in chapter 22. There's a lot of words that sound very similar. Chapter 22 is about immunology. So in some ways, it's pretty cool because we're talking about coronavirus over and over again. Some of you guys are probably fatigued with coronavirus, right? But we'll talk about why it kind of does what it does, right? Why some viruses are more lethal than other viruses. Why some of us are able to fight off viruses easier, things like that. So things that, you know, most of you guys have had questions probably about, we will kind of discuss in terms of chapter 22 in terms and relating it to coronavirus, because that virus is not going to leave us anywhere soon, right? I think this virus, and I know, actually, I don't think, I know this virus is going to be like HIV. It's going to be endemic. It's going to be with us. There's no way to get rid of it unless we find an absolute vaccine that will eradicate it. Something like we've done with, smallpox, right? Smallpox, well, we eradicated it. How? Well, we have a vaccine that was very, very, very efficient, and the virus did not actually mutate much. So then the virus that we had in 1920 was very much unchanged to the one that we saw in 1970. Because of that, the same vaccine worked, right? And that's very helpful. That's also one of the reasons why we don't see vaccines for HIV, is because it does mutate so much. And we think coronavirus might have a chance to mutate. So we'll see how long, some of the vaccines actually work. I know Fauci, Dr. Fauci, is one of those that believes that we will have some kind of protection from the vaccine, but it won't be permanent, meaning it'll be more like your flu vaccine, where you might need different ones, different strains, right? Or boosters every year. So that might be what happens with this. But, I am very, very worried about the fall, right? So I'm glad METC actually canceled physical classes, because I am incredibly worried about the fall. The reason is everybody's getting tired about hearing about coronavirus. And people will start tuning things out and start to kind of want to go back to normal. I understand that completely, right? I go back to the gym to work out now because I want to go back to normal. But in the fall, when everybody's coming inside more, right? And that's when we start, especially late fall, when we start seeing influenza, come into play as well. Yeah, it's going to be pretty bad, because we're going to see normal, maybe 15, 20,000 deaths from the flu. Add to it, now we have coronavirus, right? I think we're severely underplaying just the mortality rate. I think it's at 115,000. I bet you by the time that this actual pandemic is over, and we look back and we compare mortality rates from the last 10 years versus 2020, right? That's how actual pandemics, we find the numbers, is like 2-3 years later, we look at the mortality rates to see the changes in the mortality rates, right? Now, what we will see is that mortality rates are going to be much higher, right? So people with coronavirus that died, that are positive, that's what we're counting right now. But how many people have died that didn't get tested, right? How many people died because they didn't want to go to the hospital because they were afraid to get coronavirus? Those are all associated with the virus. So we're going to see, right? I'm pretty sure that by the time this year is over, worldwide, when we look at the actual pandemic, right, in a couple of years, now I think they say like a few, like 300,000-400,000 people. It's going to be in the millions of people that passed away already. We just don't have the actual numbers yet, right? So be careful. We'll talk more about it. I don't want to scare you guys, but I also want you guys to be kind of real and not get sick. More importantly, I don't want your family to get sick. We have enough to go through, right? And, I don't know what you guys' views are. I know my daughter and I went to a couple of the protests, right? And, the good thing about the protests that we went to sometimes is we saw a lot of people that actually were wearing masks, right? Perfect. Hopefully that stays up and we can, stay safe, right? So that's my little small political diatribe. If you guys have any questions, please email me. You guys know that I email you pretty quickly, right? So email me. I'll see if I can help you guys out. And, at least within the first day, 24 hours, okay? Usually I check it religiously every couple hours. So, right, feel free to email me. I'll stop the video so then you guys can, right? Any other questions? No? All right, so I will end the meeting, and you guys, I'm gonna send a to-do list. The first to-do thing is to review 20 and 21 and review for the test. The next thing is to take the test, right? And then get ready for the lab practical next week. So I'll send that out as well as the extra credit assignment. Okay, all right, be safe, guys. All right, and I'll see you on Tuesday.